Hi, my name is Katie Davis, and I'm an associate professor at the Information School at the University of Washington. Our research project is investigating how teens in the US and Germany are coping amid the coronavirus pandemic and what sorts of supports they're drawing on to help them get through this challenging time. Why are we focusing on teens? There's a general concern about how people's mental health is being impacted by the pandemic. And adolescence is a particularly sensitive time for the development of mental health conditions. 20% of teens live with a mental health condition, and 50% of lifetime mental health problems are established by age 14. So during this unusually stressful time, it's important to assess how teens are doing. We're guided by the following questions. The first is, how are teens in the US and Germany coping amid the coronavirus pandemic? What role is technology playing in this context? And what technology-enabled strategies can support teen well-being and resilience during stressful life events? So far, participants include 22 teens in Seattle, 15 in Berlin, and they're between the ages of 13 and 19 years. We have a three-pronged data collection approach. At the start and the end of the study, we're conducting in-depth interviews with the teens about their daily experiences and the way they're using technology. Between the interviews, we're sending them phone-based surveys 3 times a week, which allows us to track their in-situ daily experiences and their feelings. And towards the end of the study, we will also be using participatory design methods to engage them in ideating strategies to support teen well-being during stressful life events. So here are some things we're seeing so far. To track teens' subjective well-being, we've been asking them multiple times a week how they're feeling today. Here's a panel plot showing person-level data from our Seattle sample. As you can see, there's quite a lot of variation. A few of the teens are consistently reporting that they feel pretty good. Some are consistently feeling pretty low, and some are showing a lot of ups and downs. In our analysis, we'll be looking into relationships between daily subjective well-being and things like the amount and type of technology use, hours of sleep, time spent outdoors, and quality of social interactions. We're using the interviews to get a deeper understanding of the things we're finding in the quantitative trends. So here's some of the things we're seeing so far. When it comes to stress, several teens are facing some pretty serious stress. So some of them have siblings with chronic health issues that are even more challenging during COVID, like autism and cystic fibrosis. Some of them are living with elderly grandparents and they're worried about infecting them. And some of them are even finding themselves taking care of a sick parent. Teens are doing a variety of things to manage their stress, like exercising, baking, and hanging out with family. Unsurprisingly, we're seeing that technology is absolutely central to teens' daily experiences. It's essential for completing schoolwork. It provides a lifeline to friends, a source of entertainment and relaxation, and a way to pursue their interests. Sometimes, though, technology feels too central. One teenage boy told us, "I've recently been feeling like tech is taking over too much. I've recently been feeling like I need to kind of take steps away sometimes." So in terms of next steps for the project, we'll soon be conducting follow-up interviews with teens, asking them to reflect on the last couple of months, what's changed, what's stayed the same. And then we'll be engaging them in small group participatory design sessions to ideate technology-based strategies to support their well-being during stressful life events. So this study is poised to make the following contributions. It'll provide cross-cultural insight into teen resilience and well-being during the coronavirus pandemic. It'll share insight into technology's role in teens' experience of the pandemic, and it will offer new technology-based strategies to support teen well-being during stressful life events.